Integrating care matters because our lives, properly conducted, are integrated. We're not our diseases, we're not a broken arm or diabetes, we're whole people who are making journeys through our lives, and the care system has to honor and respect that. It also is a way to produce much better outcomes if you can help me through time and space instead of just in episodes. That's even more true now in an era when chronic illness is so much with us. I think the National Health Service probably has a better chance to truly integrate care than almost any other healthcare system in the world. You're integrated at the top, funded from general taxation, with a chartering duty to the public to give service free at the point of care. It gives you an opportunity to be a team, right down to the sharp end where people get care. That hasn't always been the case in the NHS. Care gets fragmented at the local community level. What I see now in the move toward integrated care systems is a chance to change that. So teams and teamwork characterize care right down to the point of contact with individual patients and families. You've got a treasure of changes here, individual places that have really experimented with new ways to deal with partnerships between general practice and specialists, new ways to help patients flow back to their communities and get out of institutions, new ways to use modern information systems to help people, new ways to build teams. All of that is now available. And as you build the integrated care systems, if you're wise enough, and you are, to tap these lessons that are distributed all over the country, you can put together models that really are based on experience. Also, the new care models programs have generated sort of faculty, clinicians, managers, nurses, doctors who actually have seen the changes, they know how they work, and they can become teachers to the country. I don't think you could be successful with the integrated care idea without elevating cooperation to the #1 position in terms of professional duties, norms, the ways we act together. That means we have to build relationships across boundaries that have been rather carefully tended. Now, to build relationships takes time, and right now the National Health Service is under enormous pressure, budget pressures, productivity pressures, demographic pressures. You're going to have to find the time. Without investing in relationship building, getting to know each other and understanding how to work together, success will be more elusive. I see that as the biggest barrier. I hope you invest in the building of cooperative relationships as an absolutely essential resource for building integrated care. The organization that I led and now am senior fellow in, the Institute for Healthcare Improvement, has articulated the triple aim: better care, better health, and lower cost, all at the same time. To that, we sometimes add a fourth aim, which is joy in work, the quadruple aim. That should be the aspiration. There's no reason the National Health Service in England can't have the best care in the world. There's no reason why you can't take an appropriate portion of your efforts and move them upstream to the causes of illness, social determinants, to prevent illness. And there's no reason why you have to waste money. You have limited resources, and you can use those resources increasingly wisely. And in that system that's focused on health and well-being and efficiency in the sense of getting the job done, you can have a workforce that's prouder and more joyous in what it does. I know how unrealistic that may sound at a time of stress, but this move toward integrated care systems, it holds the potential of the triple aim plus joy in work, nothing less.